Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is about COVID-19 and oxygen. So if you want to know what I mean by that, or if you want to learn any tips about how you can stay informed about your oxygen levels and make sure you're staying on top of things, then this is the video that you want to watch. So before I give the tip, I just want to go over a very basic idea of oxygenation. When we breathe in air, we take oxygen into our lungs, and then that oxygen gets into the bloodstream. It flows throughout your blood vessels, and it is delivered to every tissue in our body, including our vital organs like our brain, our hearts, our kidneys, and that is how we function. All of the parts of our body need oxygen in order to function. So now that we got that very basic idea of how oxygenation works, we want to talk about COVID-19. So COVID-19, a type of virus that can cause an infection, that can cause an upper respiratory and lung infection, many things, including pneumonia, including pulmonary embolism, which is a clot in the lung, including ARDS or ARDS, which is acute respiratory distress syndrome. All of these things are conditions where the lungs may not oxygenate at all, really. But basically there's a poor level of oxygenation in those conditions, and therefore the vital organs of your body and the tissues in your body, they are not receiving the oxygen that they need, that they require to function properly. So normally you're going along fine, your oxygen levels are fine, which the number that we consider to be normal for an oxygen saturation is 95% to 100%. There are some cases in people who have COPD or chronic obstructive pulmonary disease, they may, at baseline sit at a lower level like 90 or even 89. For the most part, normal is 95 to 100. And even just in general, normal is 95 to 100, even though some people's baseline may be lower than that. We have been seeing with COVID-19 that, let me compare it to before. Before, when someone's oxygen level gets below 95 and they're dipping down to 90 or 89, they can feel that. They feel short of breath, they feel labor, they feel like something is wrong, and they usually get themselves to their doctor or to an ER because they physically feel short of breath. But what we've been seeing with COVID-19 is that the person's oxygen saturation can be way below 89, even into the 60s, and the person doesn't even feel anything. I had someone the other day, their saturation was at 84, and they only came in for cough medicine because they were like, oh, all my other symptoms from COVID are pretty much gone. I just can't get rid of this cough. I want some cough medicine and I'll be good to go home. And I'm like, no, you can't go home. Your oxygen saturation is 84. You actually need oxygen. You actually need to be admitted. We actually need to do further tests on you. So with COVID-19, we are literally seeing people have lower oxygen levels, but they don't feel oxygen deprived at all. They don't feel short of breath. They're not having labor breathing. But like I said before, you need oxygen in order for your vital organs to function properly. So it is a problem. Now, the tip that I have for you is there is a way that you can monitor your oxygen saturation at home, and it is with a pulse oximeter. You can get something, it's very tiny. All you do is you bring your finger into the device and you turn it on. So I'm just gonna wait here for it to load up. and see what it's gonna show. It does take a while, so be patient, a few seconds. So I'm going to bring it here to the screen. I'm gonna just cover the brand here and bring it up to the screen and show you. If I can get it into focus here. Okay, so if you can see where it says 100, on the side of it, it says SpO2 percentage, and on the lower number, it says 80 to 81. So the top number saying 98, that means my oxygen saturation is between 95 and 100, which is normal. And the bottom is my heart rate, or pulse rate as it says on the device. 60 to 100 for your pulse is normal. So if your pulse is lower than 60, that's abnormal. And if your pulse is higher than 100, that is abnormal. Keep in mind though, if you are very in shape, you're a triathlete or any type of athlete, or you do cardio, your heart rate can be lower than 60, which is completely normal. That just means that you're extremely healthy and your heart does not have to work as hard to do what it needs to do. But this number at the top, the SpO2, oxygen saturation, that's what we're talking about. We want to be within 95% to 100%. So like I said, this little device can keep you in the know, and it even says finger out. It knows when your finger is not in. It'll turn itself off. This particular one that I have. So that is my tip for you. If you're having any type of upper respiratory symptoms, in fact, as an aside, if you are someone who has asthma, or you have COPD, or you have any type of chronic condition that you occasionally get shortness of breath, or that has anything to do with the lungs at all, I would suggest you have one of those in your possession anyway, just so you can know where you stand and you can know when you need to get help. So I hope that this video helped you. I hope that you gained some information from this, and you gained some knowledge about oxygen saturation and the tip about using a pulse oximeter in order to measure your oxygen saturation, so you can keep yourself healthy, you can keep your family, your friends healthy by sharing this information and using these tips that I give you on these wonderful Wednesdays. So if you learned something in this video, you like this video, please like it, please share it with a friend, and please subscribe, okay? Subscribe to my YouTube channel and follow me on all my social media. I have them in the description box below, but I am on Facebook, Instagram, TikTok, LinkedIn, Twitter. All of those are down in the description box below. If you have any questions or you have any comments, please put those in the comment section below. If you also have any topics that you want me to go over or discuss in a Wonderful Wednesday video, put those things in the comment section below. But here is the time where I let you know that I am so very grateful for you sharing this Wonderful Wednesday time with me. Be blessed and stay healthy.